Fatigue versus Sleepiness. I am Dr. Naras Bhat from Concord Sleep Clinic.
And I am Nipun Bhandari, research student with Dr. Naras Bhat.
Let's look at the overview of today's presentation.
Many patients who suffer from insomnia or other sleep-related disorders report feeling tired during the day.
We will discuss the two explanations for their lack of energy. One
is sleepiness, a lack of quantity of sleep,
and the second
is fatigue, a lack of quality of sleep.
So what is sleepiness?
Patients report feeling sleepy and having trouble staying awake or alert.
Patients find themselves dozing off during the day.
Sleepiness is a result of inadequate quantity of sleep.
So the consequences of sleepiness are,
as a result of sleepiness, a patient may fall asleep on the job,
or they may doze off while driving a car or operating a machinery.
They also report having trouble focusing or thinking clearly.
There is a scale called Epworth Sleepiness Scale, and which tells us what?
It's a short questionnaire used to measure excessive daytime sleepiness.
It determines how sleepy a patient is during the day.
It is available online at Stanford University's sleep medicine website.
So what is the treatment for sleepiness?
There's really a simple solution. Patients can take a nap of less than 45 minutes during the day.
In fact, you should not sleep more than 45 minutes. If you do, it would affect your nighttime sleep.
Patients can also get more sleep at night.
Or get treated for their sleep disorder and get your sleep consolidated. Now, let's switch to the concept of fatigue. So what is fatigue?
Fatigue is a feeling of being worn out or drained, either physically or mentally.
Patients feel tired during the day but still cannot fall asleep even if they try to take a nap.
Sleep-related fatigue is a result of poor quality of sleep, referred to as sleep fragmentation.
So this is called the cycle of fatigue. When you have continuous fatigue, you become sedentary. You don't feel like doing any physical activity, and that leads to
a decreased sleep drive in which you are less tired at night.
And you don't have enough sleep drive, and then you have poor quality of sleep, and that leads to more fatigue during the day again. So there is a scale called fatigue severity scale, and what does that do?
It is a short questionnaire that evaluates the patient's level of fatigue.
It determines the severity of the fatigue and the impact on the patient's lifestyle.
It is available online at the healthywoman.org website.
So what is the treatment for fatigue?
The treatment for fatigue is cognitive behavioral therapy,
or exposure to light, sport, heat, and pleasure activities that produce synergistic effect that oppose tiredness.
Also, adenosine monophosphate tablets support mitochondrial function and boost energy, known as MyB tabs.